All right, and I will turn it over to Amanda, who's going to get us started.
Good afternoon now, everybody. Thank you guys so much for joining. We recognize that you are busy and really appreciate you being on the call today. So for the project overview, the reason we're doing these projects, the CMS has set specific expectations for all facilities in Network 5 for the 2022-2023 project year. A lot of you have been involved with our projects before, so you know that these periodically change or the project you're enrolled in changes. So within this project period, you guys are going to be focusing on home dialysis and transplant. Now, it's important to remember that just because we're focusing on a home and transplant in this group for the next couple of months, your facility is still obligated to meet the other CMS goals. So you may be contacted by other quality staff to discuss vaccinations, hospitalizations, behavioral health, or any of the other projects that we have going on. If you have questions about those other goals, please reach out to one of the QI staff. We'll be happy to assist you. And you can also see what those goals are by logging into your Network 5 facility dashboard, which we'll cover more later in this presentation. Next slide, Elizabeth. So for the home modality goals, the first goal is to increase incident starts to home. The incident patients are these brand new to dialysis patients that have never had an in-center dialysis treatment going straight to a home modality. So whether that's PD, HHD, these patients have never set foot into a facility to have in-center hemodialysis. If you are a clinic with only in-center hemodialysis, you will not have an incident start goal. The next goal is the increased prevalent starts to home. Prevalent patients are those that are already established in center and will transition to a home modality. So if you're a clinic that is home only dialysis, you will not have a transition to home goal. And then for the telemedicine, their goal is to increase the number of rural patients using telemedicine to access a home modality. For telemedicine, this only applies to patients who have been identified as rurally located. And this is based off of their zip code, not the zip code of the clinic, so the patient's zip code. If you have patients that qualify for this measure, you probably already heard from Elizabeth over the summer.
Gosh. Hey.
This will also be reflected on the dashboard, and you can reach out to Elizabeth with questions. Also, for our goals, clinic-specific goals are counts. They are not rates. This is how CMS measures these goals. Next slide. Okay, for transplant goals, we increase, CMS has asked us to increase the number of patients added to the wait list. For those of you who've been involved with projects before, that is really where we started. And in the last couple of years, CMS has also added increased patients receiving a kidney transplant. We're aware that facility level staff have limited ability to control a patient actually being placed on the wait list or receiving a kidney. However, there are things that can be done at the facility level to make progress towards these goals. Your job doesn't just stop at referrals. You can and should be following up with the patients regarding initial appointments. Has the transplant center called the patient to schedule the initial appointment? And following the patient through the transplant workup process so they don't fall through the cracks. And then lastly, facility staff should be able to provide education and counseling regarding living donation and high KDPI kidneys. These two options really increase a patient's chance of receiving a kidney transplant. I think we have our first poll question next. All right. So, are you currently educating patients on living donation and high KDPI kidneys? Take a few seconds to answer this.
Amanda, I'm looking, we still have responses coming in.
Okay.
Seems to have slowed down, so I will end it now.
Okay. All right. So it looks like the majority are doing education on both living donation and high KDPI kidneys. We've got some who don't know what KDPI kidneys are. That's fine. We can give you that information. And some that are just doing education on living donation. All right, good information. Thank you. So for the measurement period, again, this is CMS driven and it is different from your organization's. These goals are CMS driven and are different from your organizational goals. The current measurement period is May 1st, 2022 to April 30th, 2023. Yes, we are already halfway through or even more than halfway through this measurement period. What this means is that any patients that were added to the transplant wait list or received a transplant between January 1st of 2022 and April 30th of 2022 are not going to count towards your goal. So if you did have patients that were transplanted last year in 2022 between January 1st and April 30th, they're not going to count in your measurement. So you will not see them when you see your rates or progress toward goal. If your organization has internal goals for home and transplant and you have met those goals, it does not mean that you have met the goals CMS has set forth for network facilities. So those will be different. If you have any questions about that, again, just reach out to one of the network staff and we can help you navigate this because it can get confusing and we do understand that. And I think, Elizabeth, I'm going to turn it over to you now.
Yes. So what is the purpose of this project? At the network, we're data driven. So we are getting information and data from several different sources. We use NHSN, EQRS, Medicare claims information, and we use that data to help us identify facilities that need improvement in certain areas. If throughout working with these facilities, we find that there are discrepancies in that data, we certainly want to mitigate that. We are also quality focused. So we are always focused on the patient first. And if we feel like there's room for quality improvement, we want to help you navigate that in a practical way. All right, I am going to use another one of our polling questions here. Let me see if I can go back to, I think it is. Okay, let me see. Well, maybe not. There we go. Can everyone see that? Do you know how to access your facility's ESRD facility report dashboard? Got a little bit of time. Okay, I'm going to bring that to an end. All right, so a majority of you guys are pretty familiar with this, which is great. A couple of you are not. If that is the case, please reach out to one of us. This is a really critical piece in knowing what your goals are and how to manage your facility's progress towards these goals. I won't spend a ton of time on it, but just to give a quick overview of this. This is the login page for our dashboard. The dashboard is the way that you can keep tabs on your facility's goals, and it's updated monthly to show you your progress towards those goals. The username is always the CCN for your facility, and there is a unique password. It does not change, and it's sent out in an email by our executive director, Brandy Vinson, each month. This password can be shared with multiple facility staff members so that everyone can log in and see what's going on. But that password, like I said, does not change from each month. I just jumped the ship. We already did that. Okay, this is the landing page when you get into the facility report. You're going to have your facility information in the top left corner. And then below that are the select measures. So these are all of the things that CMS is looking at and measuring your facility on. You can click on those different measures. And then in the middle, that measure will be represented by a bar graph. The gray bar tells you what the facility goal is for that project year. And the blue bar tells you what the facility, how you've progressed towards that goal. But above that is a little tab that will tell you when the data is from, what month. And below, it says what the data source is for that information. All the way on the right, you have a quick top gray rectangular bar that's a quick yes or no, are you meeting this measure? And then some comparisons to other facilities within the state and then within the network as a whole. And then down at the bottom on the left is a rectangular blue tab where you can download this report and print it out. It makes it a lot easier to bring it to QAPI meetings if you don't have an iPad or a laptop or something available with you at that time. We ask that you please bring these things to a QAPI meeting. It's a good way to have all in one place how your facility is performing in different areas. We also ask that you do your best to incorporate patients into these QAPI meetings. Allowing patients insight and input into the review of facility level information can be incredibly helpful. And I am going to let Renee talk a little bit more on our next slide about this piece about incorporating patients and their families into our processes and how we feel like that can make a big difference in outcomes.
Yeah, thank you. And it does make a big difference in outcomes. We have seen over the course of a few years now, the facilities that are engaging patients the most are the ones that are making the most progress towards their goals. What we know is that patient behavior change is ultimately required to meet these measures. They're the ones who choose to come for treatment and stay. They're the ones who eat the foods they do, drink the fluids, take the medicines, wash their hands and bodies, they go to the hospital. They're the ones that that are doing the things that impact our work. So we can't meet the goals without the patients changing their behaviors. And we influence them best when we include them in all levels of their care. So for example, participation in the decisions related to care planning, helping to educate their peers, and then providing insights to quality improvement efforts in the QAPI process. We have been focusing on these patient engagement areas for several years, and there are many reasons why some facilities are less successful in adopting the practices. But the approach we're taking here is to try and break it down into smaller pieces to make it more manageable and have some built-in patient-family engagement activities for all the interventions that are being offered for things that you can select from. But at the end of the project, we anticipate that a number of you will see progress as a result of including patients in these processes. And hopefully you'll also appreciate the benefit of involving patients as partners.
Okay, thank you. So now we'll get into some of the nuts and bolts. This slide will serve as your checklist or your to-do list for the project. The first item on the list was, of course, to register for and attend this kickoff call. So you've already done that. Next, you're going to select what intervention your facility will complete by filling out a SurveyMonkey. So either later today or tomorrow, you will receive an email with a link to a SurveyMonkey. It is not a long survey. It's really 1 or 2 questions where you're just communicating to us which of the interventions that that came in that initial enrollment email is the one that your facility is going to pursue. So you'll do the Survey Monkey, and then you will get another email to sign up for a call, for a one-on-one call with a network staff member. This will be done via Sign Up Genius. And during this time, we're going to review the interventions and refine the plans for implementing this intervention. After that, that is when you will actually implement this plan. And then towards the end of the project, around the end of April, you will complete a progress check report. Okay, before we move on to discussing intervention options, we're going to take a few more polls, which will hopefully serve to guide you in which interventions are most appropriate for your facility. So let me get that pulled up. Okay, this says, how do the majority of new patients at your facility receive modality and transplant information? There is one-on-one education with facility social workers, live virtual sessions on an iPad, video recording in person with a modality educator, or handouts. Okay, a few more seconds. Great. So it looks like for the majority of facilities, there's one-on-one education with the social worker for that modality education, but there's also a lot of use of handouts, modality educators, and some live and video recordings as well. The next poll is, in the past year, well, helpful if I share it. In the past year, have you had 3 or more staff members join the team who have had no prior dialysis experience? Okay, a few more seconds. All right, this one was pretty 50-50, which I have to say I'm not surprised about. Staffing has certainly been an issue. Okay, and I believe this next one will be our last. Having a patient join a QAPI meeting can be a HIPAA violation. Is this true or false? All right, almost done. Okay, so most of you knew that this is false. I guess this is subject to how you are, what things you bring up in the QAPI meeting, but really it is our goal that those patients would be included, that there isn't patient level information being shared at that time, but they are able to join with the rest of the team. And as we move on to reviewing the intervention options, we want you to consider the answers to these polls. If you're a facility where a majority of patients receive their initial modality education using an iPad or a modality educator, it might be that one of the intervention options that considers establishing a PCT champion would show a bigger impact. That way you have a pretty consistent availability of staff members who can speak to your patients at the exact moment that they have those questions. If you have a lot of new staff, particularly those that don't have any dialysis experience, focusing on staff education of modalities may be the most helpful intervention. If you haven't or don't pursue patient involvement in QAPI, making that a focus may be best. All right, and now Amanda is going to lead some of the conversation about the interventions and field questions.
All righty, so the intervention options, I'm not going to read this entire slide to you because it's a lot, but I want you to make sure that you read the interventions carefully. You should have received a link to these interventions when you received the project notification, so these should be somewhat familiar to you. And as you saw in the project notification, if you are using an intervention from column 1, you only need to choose the one intervention or more if that is what you'd like to do. But if you are choosing an intervention from column 2, you need to choose 2 of the interventions in that column. That being said, these interventions go beyond just posting a bulletin board or hosting a lobby day. A lot of you guys probably already do that, but to expand, we want you to expand on that. So most of these interventions incorporate some type of patient involvement and or feedback. And during the one-on-one calls, we'll discuss how to move education efforts into action and measure impact. So for example, if your facility is chosen to host a lunch and learn for the staff, there needs to be some type of follow-up component to the intervention that will involve the staff putting that education into practice and measuring results. These interventions were chosen because they have been successful in the past for other network facilities. You are not obligated to pick one of these interventions if there is another intervention that you have in mind that would work better for your facility. This is something that we can discuss on those one-on-one calls. But I do want to give you the opportunity to ask, I guess, any questions that you have about this list. Now you can put it in the chat box or come off mute and ask the question if you'd like.
I do know for registration for this meeting, there were a few questions that had come up through that venue. One was about lobby days and if those were allowed at this time. We certainly know that there are facilities who are doing lobby days at this point. I would assume this is more dictated by corporate policies. We have reached out to some management at this particular corporation to kind of get more feedback and have not heard back. But if they are not allowed, you would just want to choose a different intervention, but we are following up on that piece. I believe I also got a question about if you have a home modality educator, would you also need to choose a PCT champion? I would say yes, because you want all of the staff in your facility to have some at least base level knowledge about modalities, home dialysis, transplant, so that you don't leave a patient in a situation where they have a question and they have to wait a couple of days or a couple of weeks for that modality educator to come back around and answer the question. Also, we know those PCTs are the ones seeing them every day, extended periods of time. And so having them with a level of feedback and positive attitude about it is going to be really helpful. Anybody else have any questions? I don't see anything in the chat. All right, so we will move on. But if anything comes up, please just type it on in. One of the interventions did talk about doing a bulletin board and then subsequently playing a game. And this is based off an intervention that we heard about in our last project group. This is from US Renal Care Oxon Hill. If you look at the information that's on this wheel, you can tell it's not specific to home and transplant, but I did really like the idea. They had created some educational bulletin boards for their facilities, And then after the bulletin board had been up for a certain period of time, they played a game during treatment, and it had questions that could be found on the board. So it felt like a really low stake way to test their knowledge, to provide some education. And at this particular facility, they were dealing with some misinformation about home dialysis. And it felt like sort of a low stakes, non-challenging way to introduce that. And I really like the picture of the wheel of something that could be sanitized between different patients. So I thought that was great. Sign Up Genius. So one of the biggest hurdles that we have encountered in our previous project work, doing these one-on-one calls with facilities, is that Sign Up Genius does not automatically sync the appointment to your work calendar. And as I mentioned earlier, Sign Up Genius is going to be the platform that we use for letting you select a date and a time to have a one-on-one call with the network staff. So we're going to run through really quickly just a couple of ways to make sure that you can sync that appointment. You just have to do it manually. So this is the sign-in page. When you follow the link to sign up, this will tell you the title, a little bit of information, and then it will say location. So at the very worst, you can always sign back into the sign up page and click on that link to get into the meeting. Once you have selected a date and a time, this screen will come up and there will be these green blurbs here at the bottom. One is add to calendar. I'm assuming most places are using some version of Outlook, but you can choose to sync it to whatever calendar you are using. And then this will pop up with an email. It's in the location field under subject that it actually gives the link to the Zoom meeting, but you will then click save and close and it will be on your work calendar. At the very least, if you have missed all the other things before or just forget or it gets lost, you will get a confirmation email from Sign Up Genius, and the ability to add it to your calendar is right there in the message section, or you can go and search Sign Up Genius in your email box, click view sign up, and this will take you back to that landing page where you can find the Zoom link. Okay, and this slide is just to hopefully provide some perspective and encouragement. These are some results from only a few months of data from our last project. So I know that working on this project from February through the end of April is not a lot of time, but we have seen movement in projects before. So this is information that we had about facilities between September and December of 2022. In that time, 51 facilities added at least one patient to a wait list. 52 transitioned a patient to home dialysis. 37 patients received a transplant. 9 facilities included a patient in QAPI. 17 facilities included a self-directed goal in a care plan document. 11 facilities referred a patient for training or pairing. So again, that's just something to hopefully kind of encourage you that this can have an impact. And a refresher on next steps. So after this call, you're going to review the intervention options chart that came in your enrollment email. Please, please, please discuss this with your team so you can hone in on which intervention is going to be most appropriate for your facility and for your patients. Then look for an email with a SurveyMonkey link, and you can select which interventions your facility will implement. That's how you're going to communicate to us what your plan is. And then after that, you'll get an email with a Sign Up Genius link to select a time slot to review and refine interventions. Those are the big steps that come next. And lastly, we always like to just remind facilities that cooperating with the network and pursuing network goals is a part of the conditions for coverage in participating with the Medicare program. And here are all the contacts for the people that will be your points for this project. And we can take any questions, anything that I have not covered or I forgot to mention for registration. We can work on that now. Renee or Amanda, is there anything that I didn't cover that you guys would like to clarify?
Nothing on my end.
Okay.
Yeah, I can't think of anything.
All right. Well, I don't see a lot coming in through the chat. So certainly take note. You should have our contact information from the enrollment email. If you think of something after the meeting, please shoot us an email or give us a call and let us know. And we look forward to working with you guys in the next few months. Oh, okay. We have who can I talk to about getting on track with our projects? We haven't had consistent managers for the last 2 years. You can contact any of us. Probably your best bet is to contact whichever network staff member sent you a project enrollment email, but really any of us is something that you could get that information from. And who would I speak to about logging into the network? I assume you mean that dashboard that we went over. Certainly shoot one of us an email and we can get you the login and password information that you need. Okay, well, if there are no other questions, we will let you guys go. Thank you again for taking time out of your day to join us here. And enjoy the rest of your day.